Hello.
Very good evening. Very good evening. Thank you so much for joining for the session. So
Good evening.
we'll be starting the session now.
Okay.
Okay, ma'am. I request you to keep your audio off, and only when you have to ask questions, you can keep it on.
I don't know. Understand?
Hello.
Hello.
Okay. So very good evening, everyone. Thank you so much for joining today. And so today we have a very interesting topic, and you're probably aware of speech and language disorders in children, which is probably because of autism or stuttering or speech sound disorder. Um, but what if the child has good speech and language skills, but is unable to express it properly in a social context? So that brings us to our today's topic, which is social communication disorder. And this condition is something that makes it hard for children to talk with other people. It's not a problem with speech. It's also not a problem with the mechanics of language, like pronouncing words or using grammar. So, social communication disorder, also called as SCD, it impacts a specific area of language, which is called as the pragmatics. And this is the use of language in a social setting. Okay. So, this will be discussed by our resource person, our speaker for today, Miss Navya Gopalakrishnan. And Miss Navya has done her graduation and post graduation from Kerala University of Health Sciences, and she's also certified in Gestalt language processing, and that Gestalt language processing from Uncleft, and oral placement therapy from Talk Tools. And she has an experience of over 6 years, and she has dealt with a variety of language disorders in children during this period, and she has been providing teletherapy since 2022. And we'll start the session. And before we start, I would request all of you to keep your mic off. Okay, so over to you, Navya ma'am.
Thank you so much, Tara. And very good afternoon to all. I know all of you are very busy, and from your very busy schedule, you have all taken time to attend our webinar. I'm sure this will be definitely informative for each one of you and for your kids. So, just like Sarah has introduced the topic, I think we can directly move on to the topic. If there's any issue with my screen sharing or things, please let me know.
Yes, yes, Navya, ma'am. It is absolutely fine. You can continue, Navya, ma'am.
Yes, yes. Thank you so much. Okay. So I just want to tell you, add on a little from whatever Sarah has already told you. We get a lot of complaints each and every day from parents saying that my child has not started saying the first word. He started combining words. Some of them say that they have not started forming sentences. So, and we have webinars earlier also, which has addressed this. But today's topic is slightly different from things that we have discussed. An issue which we see in kids, in which the language of the child is actually or fine. That is, they'll have a good vocabulary. They might be speaking in sentences, but still there is an issue while this issue with the social communication. So this is what we are basically going to speak about today. Yes, the agenda. So we'll be dealing with what is social communication, understanding social communication disorder, key impacts, red flags, and its diagnosis and treatment. Firstly, coming to what is social communication, just it's communication socially or communicating for a social purpose. Social communication has a few components. First one is pragmatics. Now, understanding this word is very important because even as we move forward, the further slides, we will be speaking about pragmatics. So, pragmatics is nothing but the social use of language. Communication that focuses on goal, consistent use of, uh, yeah, yes. So, and then it is basically nothing but the social use of language. This is one of the major component of social communication. Then is the social interaction. Social interaction, social interaction is communication that occurs between at least two individuals. We know that communication happens when there are two people. So social interaction is also similar. You should be able to communicate with at least two or a group of people. Next is social cognition, the process by which people think about and interpret others and the social world. So this is basically social cognition. See, uh, just the basic thing is how we understand the others or what we think about the others. For example, we all uh, we always think about, is this person a friendly person? If yes, okay, let's talk to this person. Or some other person, I don't very friendly, seems a little rude. Do I have to speak to that person? Or earlier, whenever I spoke to the person, I have had some negative things. We already have a judgment about the only after that we go and communicate. So that understanding, that also comes under social communication. Then is the language is nothing but how well the person is able to speak and understand language. Now, social communication skills, what do they include? First thing is adjust speech style based on context. Now, what is this actually types of contexts? One is the way you speak to a friend and the way you speak to a senior official of yours would be very different. Understanding that is one thing. One thing, another thing is the way you speak at a business meet would be very different from how do you speak in your home setting or what would be your dining table conversation. So these are all different contexts. How would you behave in a library? How would you behave in a marriage hall? So it's all different. So these are the different contexts. And social communication skill means this person, whoever is speaking, should be able to adjust the communication style based on different context. Also understand the perspective of others. That also comes under social communication skills. You should, which otherwise means that you should be an active listener. You should also listen to what others have to say. And then is understanding and appropriately using the rules for verbal and non-verbal communication. Rules for verbal communication is you wait for the others to finish or you do not interrupt in between. Knowing these kinds of basic things, that is the rules of verbal communication. And what is the rules of non-verbal communication? The way you have that kind of eye contact with the person, how attentive you are while the other person is talking. Also, another thing is the, sorry, hello.
That
Okay.
probably was a
So,
mistake, Navya ma'am. You can continue, Navya ma'am.
okay, thank you so much. Okay. And then it is basically the non-verbal proximity. Proximity is basically, see, there we know that there is a particular distance that you have to keep. Know that, okay, we have to stand at a particular distance. We shouldn't be too close to that person. That does not look good. Okay, this is the distance that we have a basic understanding of all these things. So these are all the rules of non-verbal communication. So the social communication skills include all the structural aspects of language, that how well you use the language. So this is what is basic social communication skill. Coming to what is the social communication disorder, you might have already understood. We have seen what is social communication. So social communication, these kinds of skills are disrupted in a child. So yes, child with social have no problems understanding the meaning of individual words, developing a vocabulary, and comprehending grammar. Basically, they have no issues with the proper language, that whatever, like whenever we say child is not saying the first word, not saying second word, this might not be for this social communication disorder, definitely that might not be the case. But still, they will struggle with the pragmatics or the social use of language. For example, people who have social communication disorder, they may not understand things properly. They may not be able to greet someone properly, or they might not know how to take turns in a conversation, or they do not understand when do we use a formal tone, when do we use a familiar tone. For example, we do not use the same tone while speaking. Compared to that, we are speaking to friends. We know it is very different. With whenever it is a friend of ours, we know the tone would be very different. And in the other case, it would be a little bit formal. So children who have this issue will have difficulty in understanding all these kinds of things. Now, children with social communication disorder might also have more general behavior or emotional difficulties. For example, they might feel anxious or worried, particularly in social situations. Also, they find it hard to concentrate or pay attention, and they might have difficulty managing their emotions. Why all this? We will discuss in our coming impacts of social communication disorder. Because a child or a person has this social communication disorder and it cause to your child. First is the social isolation, because they always feel that nobody, so they always feel that kind of isolation. People might speak about something and suddenly when, or they would say, no, anybody, anyways, you would not understand. Things like that, maybe they have faced. So that leads to a social isolation. This relationship challenges means any kind of relationship, friendship, anything, because these people or these children express their emotions or needs. They may be feeling sad, but they do not know how to express. They may be happy. When they express, it would be something else. They are not able to basically regulate, and they are not able to express accordingly. These kinds of relationship challenges. Another thing is academic difficulties. Now, why academic difficulties? Because we know in a classroom setting how we will have some sort of a group discussion or a project that you have to complete together. So all these areas, these children, because they do not know how to involve in a group, they do not know how to start the conversation, they do not know how to get in between. All these things happen. Thus, they'll be having this academic difficulties. Another thing is occupational challenges. Occupational challenges also due to the same reason, the work dynamics, they will not be able to follow that. They may not be able to maintain maybe very good client relationships because of the communication issues. Because of all these, they might have this low self-esteem. Excuse.
Ma'am, please,
Okay.
you please mute your mic, please. Yes, Miss Navya, you can continue.
Okay, so this is where I told you previously, anxiety and stress. So now you might know very well why these kids develop this kind of anxiety and stress, because they always feel this negativity whenever they are in a social situation. So that is one of the major reasons why they are always anxious and why they are always stressed. Now coming to the red flags. Red flags is that is how do you know that my child may develop or may have this kind of a social communication disorder? Now, whatever I'm going infants and toddlers, this is very similar. I mean, this is just the basic developmental milestone. So, this is not only for social kind of a language delay. That is no babbling or cooing by 6 months. I'm sure most of you know about these things. No gesturing by giving, these kinds of things are not seen even when the child is 1 year. No single words, even when the child has reached 1.5, child should have started using at least single words by 1.5 years, and this child still does not use. And no two-word 4 months, not able to combine two words and form a phrase, even when the child has reached 2 years of age. Another thing is no eye to name. These are basic red flags that you can find in infants and toddlers. But it is not necessary that any kid or all the kids who have delay in this will develop a social communication disorder. It is not at all like that. That is why I told you any language issue, this would be the developmental part. And if the child does not, there are no chances that the child might develop a social communication disorder, and there are also chances. That is all. So you cannot say that just because my child is delayed, my child will develop. It does not happen that way. Now, red flags in preschoolers. So preschoolers is basically 3 to 5 years of age. Now, all the points that we discussed becomes a little more dominant. Because why? Because the child has started speaking now. So you know how the language of the child is. Also, when the child starts speaking, there is difficulty with eye contact. Also, difficulty with eye contact, the child might not be able to maintain that eye contact while speaking to another person, and maintaining the eye contact is very important. You know, if a person who is speaking to us does not maintain eye contact, we know how it feels. So these kids will have this kind of an issue. Another thing is trouble understanding tone of voice. Now, this is very, very important. You know, aspect, many shout at our kids maybe, or whenever we change the tone of voice, Usually the child should, my father is angry, let me stop doing this. So these kinds of children with social communication disorder might not basically understand this. Even if you change your tone, even if you are being harsh or rude to the child, or if you are being strict, the child that you are actually angry. The child might continue whatever the child has been doing, even if he or she shouldn't. Another thing is difficulty with turn taking. Turn taking basically happens in plays as well as in speaking. You group of children, they all start playing. So when we tell them, first it's your turn, you throw the ball, and then I will turn the ball. I will have difficulty in understanding all these things, and even if they understand, they'll find it very difficult to follow. That is enough to wait for their turns. Now, this can also happen in communication. But like when you speak, the child might also speak in between. But at this age, that is very normal. So you cannot actually link that with language, but definitely in play-based activities, you can see this. Another thing is trouble understanding non-verbal cues. So this is also another thing. This is just an example. You take your kid outside, maybe to your friend's house, and you see them jumping on the sofa there. So you basically don't like it, and you don't want to tell in front of everyone, don't do that, just just jump. All these things you don't want to tell them. So what many parents do is they either look at their kids, very stern look that they give, and the kid automatically understands, my mother is not very happy with this, so I have to get down. These kinds of children who actually have the social communication disorder might not be able to understand these kinds. Another thing is delayed or absent pretend play. Many of the kids in this 3 to 5 year old age group, pretend is actually kinds of role play. They might play something like kitchen or doctor patient, something like that. So the social communication disorder will not be very active in this pretend play area. Next, in school-aged children, that is 5 to 12 years. Now, this is the time when most of the issues of communication becomes the most prominent, because the child might have developed a very good language and very good sentence formation skills. Here would be that they will have difficulty initiating or maintaining conversations. At times, and they will not want to come and greet, or they will not be able to come and greet you. Even if you do so, they might not be able to reciprocate, or you ask them to speak about something, they'll start with that but end up somewhere else. For example, you ask them, what did you do at school today? They might start with, today at school, my teacher came at 8 o'clock, and then suddenly they'll switch to a topic. Today afternoon, will we have TV time? So basically, no connection between what they have started and now where they have headed to. So that is one major issue that we see in the school age children, basically not able to maintain conversation. Another thing is trouble understanding the nuances of languages such as idioms, figurative languages, etc. That is mostly what we see is children just understand the literal meaning of the language, because uh, anything conveyed in a different way, they don't understand, because we know that we all might be using this kind of a language when kids may trouble us, like they'll be asking, where do I keep this, where do I keep this? They might know where to keep, but still they'll continuously ask us, and we would be like, don't keep it anywhere, just throw it somewhere. And they will, because they'll not understand that it was just a way of communicating things in a different way. They will actually take the don't keep it anywhere, just throw it away, they will throw it away. This is what this is for that basic understanding. This idioms. in communication, we use things like, we use phrases like, no, I don't think I'll be able to do that. That's not my cup of tea. So, cup of tea does not actually mean the cup of tea, right? It's like basically not of my interest, or I wouldn't be able to pull it off. These kinds of things, kids who have social communication disorder will have much difficulty in comprehending. Another thing is difficulty with social interaction, that is sharing, taking turns, cooperating with peers, everything they'll find very difficult. Trouble understanding body language, facial expression, tone of voice, all these things. Body language. Why we say body language is, for example, you're not well. And I'm not feeling well, I'm not feeling well. And you sit like this. Okay. So, like when we meet someone in a situation, or this is their body language, or they do something like this, we understand from this body language that they are not, I don't good to talk. Let's not talk to them now. So this is basically how we interpret the body language. So with social communication disorder might not be able to understand these kinds of body languages also, even if uh, you show that not very interested in conversing right now, these children might again come to you because they don't understand any issue with this kind of a body language. And avoiding social situations or interactions. Many a times they will find it with people.
Ma'am, are you there? Navya, ma'am?
Yes, 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 yes. Hello. Am I
Yes, ma'am.
audible?
Yes, ma'am. Yes, ma'am. You're audible, ma'am.
Oh,
Okay.
there
Yes,
was
ma'am.
an
You can.
issue with my connection. Sorry.
No problem, ma'am. You can
Yes.
continue, ma'am. You can continue.
So much.
Okay, ma'am. Also, would like to remind you, ma'am, that half an hour more to go.
Yes, yes.
Okay, ma'am.
Sure. Thank you so much for reminding too. Yes. So, yes, they avoid social situations or interactions due to this feeling of anxiety or insects. Next is, how do we come to a conclusion that my child might have a social communication disorder? This diagnosed children as young as 4 or 5 years old, although milder deficits may not become apparent until early adolescence. Around now, you already know. Why do we say that? By 11 to 13 years old, we will have, because we will see that developmental delay happening, or all these issues that we discussed so far, and their language might have developed because of it makes it easier to identify. Um, yes. Also, in some cases, it is seen that most later in life, even in adulthood, that is, this could be mainly because the symptoms would have been younger, so that it might not have been, there might not have been an intervention done, or because of which they cope up. I mean, they must have developed coping mechanisms of their own, and thus they were able to compensate for their communication difficulties. So, diagnosing social communication disorder, it involves a comprehensive evaluation by a speech language pathologist and a psychologist. It has a lot of assessments to be carried out, like clinical interviews, behavioral observations, standardized tests, and exclusion of other conditions that may have similar symptoms. Because most of the developmental issues, we have seen very similar symptoms or signs. So we should actually differentiate and then only diagnose this particular disorder. So these are some of the methods for diagnosing. So few are the materials that we commonly use. Another thing is talking or interacting with the teachers and parents of the kid. And then we formal assessment, mostly the informal assessments where we speak to the child for a particular duration, maybe 15 to 20 minutes, and we know how things with us. Also observing the child in a setting with others. Using questionnaires that measure other medical and neurological conditions that affect speech and language must be ruled out, such as that is developmental disorder, global developmental delay, or other disorders. See, these are all disorders which are social communication disorder cannot be diagnosed with any of these developmental disorders. But it can co-occur with other communication disorders like language disorders. Speech sound disorder is basically when the child is not able to speak clearly. The childhood onset fluency disorder, that is nothing but the stammering that few of the childs are presented with. An unspecified communication disorder. Unspecified communication disorder is when the child has certain issues with communication, but we cannot actually put put the child into any category, or we can't say that this child has this issue. No, from everywhere, the child has some issues and which is affecting the overall communication of the child. So in all these cases, yes, social communication is seen to co-occur. How the social communication disorder differs from autism. Autism, as such, is a very lengthy topic. So I would just like to brief you about what it is. Autism also has a lot of social communication issues, just like what we spoke now. But the major difference is that when coming to uh, a child with autism or autistic population, all these things that we discussed so far would be more severe. Or other than all this, they'll have major other communication issues, and major differentiating factor is that children with autism will have a major repetitive pattern of behavior, or any kind of repetitive behaviors, or any kind of intensely fixed interests that they have. That is this insistence of sameness. They might not like this change of routines. Every day they take bath at 7 o'clock in the morning. One day you change that, you make them bath at 9 o'clock. They might not like it. Or in this room, the stable is kept at the left corner. One day you change the layout of the room, you keep this on the right corner. The children are not going to appreciate even these kinds of very small things. They'll take it very personal, and it will be very irritating to them. So these kinds of intensely fixed interests, these kinds of repetitive behaviors will definitely not be a disorder. So it is very important, even while diagnosing, that we do not mix up these two. It is actually, yes, also autistic population, we see a lot of sensory issues. That is, they might be having certain sounds, maybe certain textures, maybe they do not like to touch certain kinds of substances. So all these types of behaviors may not be seen in social communication disorder population. In order to arrive at a diagnosis that the child has social communication disorder, it is very important that autism must be ruled out. Cannot be diagnosed in conjunction with autism, and vice versa. Basically, it cannot be diagnosed with any other existing diagnosed with any other developmental disorder. What are the treatment strategies? The main treatment for social communication disorder is speech language therapy, and SLPs have a lot of variety of treatment modalities, methods, and we can work with kids on conversational skills either on one-to-one or in small groups. And it's also critical for teachers and parents to reinforce these with opportunities to use them in school and at home. As a speech language pathologist, we can definitely help the child and the parents in letting them know that these are the things that you have to work on. So, on a regular basis. But again, the child has to generalize the skills. The child has to understand this should also be used in the settings outside and not only with the therapist or not only in the clinical setting. So, for this, we will definitely require the help of school as well as parents at home. So, what are the key skills that we have to develop, or what are we trying to teach them during our speech therapy sessions? First is the speech pragmatics training, that is, how to socially communicate, how to communicate in a social setting. That is, many of the kids do not understand things like sarcasm, just like I mentioned, idiom. Sarcasm is someone is making fun of them. They do not get that very well. They do not understand that they have been made fun of. So all these things with different activities, we'll be able to will be able to. Another thing is conversation skills. Kids with social communication disorder often struggle with back and forth is asking and answering questions during a conversation. So SLPs can actually engage in role play to help a child develop. This is, for example, in a classroom setup, how it works. You have to communicate something to the teacher. For example, the teacher, and this child has not brought the maths homework, the child wants to communicate. So if it was us, what would we do? We know it's a classroom setting. The teacher has to notice that we have raised our hands, and then the teacher will ask us what is the thing, and then we have to tell them or whatever the reason. Now, the child who actually has a social communication disorder might not be able to communicate, not speak at all. Like, even if they have not, they know that they are going to be scolded, they know that they have not brought the math homework to stand up and ask. This is the case of some kids. Some other kids show this, that is the teacher, but they would not ask for permission, which would lead to more issues because the teacher or the other person might feel that this child is being arrogant. Okay, so these kinds of things will be better worked on when given role plays and similar activities. Another thing is the non-verbal communication. Non-verbal communication is learning how to use language to non-verbal language to communicate effectively. That is, exactly, if someone is not in the mood, like we see the children's parents coming up with a complaint that my child is not able to make friends, or even if he has friends, I don't know, he loses friends easily. So just like we discussed before, they are not actually able to communicate well, not able to express their views and emotions. And also because they cannot understand the nonverbal cue. Even if the other person is not very happy, this child will tend to go and talk to the friend, which might actually uh, disturb the friend. And so we don't know what would be the reply and what would this child feel. So there are these kinds of things happening. So lot of like body language interpretation, what is the meaning of each kind of body language we have, like if you know that maybe there's a loud noise or this person does not want to hear what we have to say, we are speaking and somebody does this, we understand that in our conversation we will leave. Now these kinds of children may not be able to understand that it is because the other person person is not, they might stand there, they might speak even more and more. So these kinds of things always keep happening. So we work on all these things, what different body postures and body languages mean. Also, parents and teachers supplement SLPs by family real life conversations. This is just what I discussed to generalize this to things out setup as well, or it should not be followed only with the clinician, it should also be followed in other places. What we can do is model social speech. Model social speech is nothing but like when you join a conversation or when you enter a classroom, the language patterns that we have to use. For example, we can ask like, mind if I join you, or may I come in? Can I use that? So these are all a kind of examples of social speech. Another thing is point out social speech situations. This is the same. That is, we have to make them understand that this person is not in a good mood. We can understand by this kind of a body language. So it's better not to avoid this at this point, and maybe some other time we will go and talk. Role plays. So role plays can basically be this type. Pretend that you are introducing yourself to each other at a party, or any other things, maybe a classroom scenario by giving different scenarios, or maybe a child coming late to school, or child who has not brought homework, or maybe a child who has had fight with another student in the class. Many different kinds of situations can be given whereby the child can actually enhance or develop their skills, the skills wherever they are lacking. I'm sorry. Outlook structures in place, people with social communication disorder will definitely have happy, fulfilling lives. And what and this social communication disorder may not be craving the same social interactions or communication like others. So it is always we have to think from their part as well, and not force them very much into things that they, but we have to, as their clinicians or as their parents or teachers, we definitely have to accommodate this kind of cognition. People with social communication disorder may also need accommodations at work or in school to reach their so yes, we have come to an end. Thank you so much for being there. And yes, any question
Thank you.
me, or we
Thank
can
you. Thank you so much, Navya
answer.
ma'am. Any
Yes.
doubts or any queries from the audience? Anybody? You can turn on your mic and you can ask the question. Yes, Miss Shamili Matthew, you have a doubt? If a child with anxiety, how to help the child? All right, okay. Over to you, Navya ma'am.
Yes. Okay. See, social anxiety, if the child have, see, social anxiety is a very different thing. And also, social anxiety, kids who have social anxiety, it is not necessary that they have a communication issue. That is, they show this kind of social anxiety only in situations which are unfamiliar to them, and also
Tanzim ma'am, are you saying something? Tanzim ma'am, your mic is on. Should I? Yes, ma'am, you have to say something. All right. You can carry on, Miss Navya.
so social anxiety is not the same as social communication disorder. As I social disorder, kids actually have a problem in communicating in every situation. It is called a social communication doesn't be able to handle. But things like I have discussed, topic initiation, maintenance, these kinds of things, they will not be actually doing it perfectly. Parents or siblings who have been with them since they were a child, even with them, these children will not be able to communicate In this is not the case. They actually communicate well. They actually report everything to their parents. The only thing is when they come to an unfamiliar situation, it is very difficult for them to handle, and it is not mostly a communication issue. I hope that's clear.
Thank you, Navya ma'am. That was a beautiful explanation. Ma'am, Shamali ma'am, did Navya ma'am clear your doubt? Okay, I'm assuming the doubt is cleared. Okay, so we have another doubt. That was, I think, Nitina ma'am, who has asked any specific test material for social communication disorder assessment.
Yes, definitely. We have a lot of pragmatic checklists which we use in order to arrive at a particular kind of an issue, along with many informal assessments.
Okay, okay. I think the doubt is cleared. Yes, ma'am. Okay, so Hannah also ma'am is asking, so autism and social communication disorder, is it similar? I think that was discussed during the session. Navya ma'am has clearly
We
explained
discussed.
that. So would you like to explain that again, Navya ma'am, in brief?
Fine, not yes, not a problem. See, ASD and social communication disorder is actually very different. Just like I have already mentioned, autism spectrum disorder has more to do with a more serious aspect of whatever we have discussed. Like other than the social communication issues, they have a lot of other issues like sensory issues, this insistence, sameness, and the repetitive patterns of behaviors and interests. All these things will not be seen in a social communication disorder, and hence there shouldn't be between SCD and ASD.
Okay, thank you, Navya ma'am. I hope that is clear now. And we have one more question from Deepam ma'am. Hi, my child is always doing self-talk stories. If he's getting bored, how can I stop that?
Okay, first thing, I do not know the age of your child. It depends on how old your kid is. If the stories that he makes is only during his boredom, I think he is being a little creative. So, otherwise, only when he's bored or when he's playing with something, if he's creating these kinds of stories, I think it should not be a cause of concern unless and until there are any other serious communication issues that you notice.
Yes, thank you. Thank you, Navya
Yes.
ma'am. I hope the doubt is cleared. Moving on to our another question that is by Sajna ma'am. Hi ma'am, my child is 2 years and 5 months, yet she's not talking. Should I take any further awareness for her? She's a preterm baby. So that is the question, Navya ma'am.
Yes, the child is 2.5 years, and if your child has not started yet talking yet, you definitely have to take a consultation or checked with any qualified professional, and we will have to work with your child's speech and language skills.
Yes, that's correct.
So do
Thank you,
not
ma'am.
wait more.
That's correct, ma'am. Yes, thank you, ma'am. Another question by Linish. So the question is, hi, my child is 2 years, 4 months, and he's using only few words to express his things. And it is it a speech delay? And do we need to consult any doctor? That is the question.
Again, very sure if I'll be able to clear your doubt completely. But if your child is 2 years, 4 months, and if he is still using only few words to communicate needs, have a very good vocabulary, and if your child has not started combining two words and forming phrases, I think you will have to address this matter.
Yes, correct. Okay, Navya ma'am. Moving on to another question, which is by Miss Susan. Yes, Susan ma'am. So the question is, social communication disorder, is it only assessed by a speech language pathologist? So that's the doubt she has.
Social communication disorder. Social communication disorder is actually a relatively very new diagnosis. And yes, so far, the speech language pathologist, along with the psychologists, are the people who are currently diagnosing the child as social communication disorder because it is clearly a communication disorder.
Yes, thank you, Navya ma'am. So I hope that's answered. Susan ma'am. Okay, next one. Okay, the next one is not a question. It is a comment by Miss Saida. Saida ma'am says it was a very informative session. Thank you, Navya ma'am. Thank you, Miss Saida.
Thank you so much.
Okay, and yes, so Deepa ma'am was mentioning the child's age, which is 9 years, because
She has mentioned
she
something
had not
earlier.
mentioned earlier when she had asked the question, "Hi, my child always doing self-talk
Yes, yes,
stories,
yes.
and if he feels bored, how should I stop?" So he's 9 years old, is what Deepa ma'am is telling. Okay, and moving on to our
Yes.
another question by Riza ma'am, I suppose. Yes. Who will diagnose social communication disorder? Is it by psychologists or
Answered that.
speech like? Yes, Navya ma'am just answered that question. Now, one more doubt I think is, can you please, yeah, that is by Shamali ma'am. Can you please mention few test materials, the names of the test materials? I don't
Of course,
think
she is a speech pathologist, not a
exactly.
parent.
Shamali, ma'am, this will be done by a professional speech language pathologist. So I think you'll have to consult a speech language pathologist for that. Okay, anyways, moving on to another question by Miss
Yes.
Ranjini. Ranjini, ma'am, she says, "Hi, ma'am. My child is 3 years, 5 months. He has speech delay. Speech delay affected his academic, and I mean she has mentioned it as a speech delay affected his academic failure." Okay, so ma'am, you're probably asking how, I mean, she's not
I,
explained the question properly. She's probably asking how to tackle the speech delay and his academics probably. Yes, so Navya ma'am, you have an answer
yes,
for that?
I don't think you have to consider this as an academic failure at all if you feel so, because your child is just 3 or 5 months. Okay, so I think if you feel that your child has a speech delay or a language delay, please consult a qualified professional and please see what can be done. A qualified professional will definitely be able to help you and your child. And once he gets the proper intervention, all the other issues we'll be able to sort out gradually.
Yes, yes, correct. Thank you, Navya ma'am. So I hope that is answered. And moving on to another one. Okay, this is a comment by Hanu Altu ma'am. She says, "Thank you, ma'am. I am Ifsan's mother. Navya ma'am is our therapist," with a lot of heart emoticon. So thank you, Hanu Altu ma'am. Thank you so much. Thank you. Okay,
Yes,
and
Ifsan is one of my kids.
yes. Moving on to another one, Miss Sajna is telling, "Thank you, ma'am. Thank you, ma'am. Sajna, ma'am. Thank you for that reply."
Yeah.
Uh,
Welcome. Mhm.
Another one is a question by Bimla, ma'am. She says, "Hi, how about if a child does not have eye contact, but child can copy the word and child knows by picture what is it, and talking self in self language." I think talking about self is what she's trying to tell. Okay, I can, yeah. So yes, ma'am, Navya
Yes.
ma'am.
Again, the details are not very clear, and the age of the child
Yes,
is not
yes,
mentioned.
yes, yes,
So I think copying the word, we do not know what is this copying the word. Is it written or is it just repetition? It is not very clear. If your child has difficulty, I mean, if your child only copies the word, considering your child's age, I think you will have to consult a qualified professional.
yes, that's correct. Thank you, Navya ma'am. Okay, moving on to another, yes, another question, which is by uh Miss Kamal Nawaz. And the question is, "Hi, my child is 20 months old. He started speaking now, only mama, ball, car. And if we say anything, he is doing, for example, if we ask to take a ball or go and drink water, such a small thing he's doing. Is it normal or should we consult a doctor? That's the question.
Okay, 20
Um,
old. That is, I think,
Approximately 2 years.
1.5 years.
Yes. 1 year, 8 months. Yes, yes.
Yes, he has started speaking a few words and take a ball or go and drink water. Yes, it is fine, but then again, 1.6 years, and if it's only 3 words, I think we will have to work on his vocabulary. That is, your child should be saying more number of words. I feel we contact a qualified professional for this. There wouldn't be much of an issue or delay, is what I feel, since your child is able to just follow the instructions. So, yes, I think it would be definitely better for you if you can do this.
Okay, okay. Thank you, Navya ma'am. I hope that is answered. Miss Kamal and okay, Shamili ma'am is saying that she is a speech language
Yes,
pathologist, so which is why she was inquiring about the
we
test
got that.
material. Okay, Shamili ma'am, we'll get back to you and we'll
Yes.
discuss about the test materials. Okay, and another one is Deepam ma'am is saying you're always giving valuable things. Thank you. Oh, thank you so much, Deepam ma'am. That means a lot. Thank you so much. Okay, moving on to another question by Miss Fatima. Fatima ma'am says, my son was diagnosed with a tongue tie at the age of 28 days, when he was 28 days old. Now he's 2 years and 10 months old. He speaks very little. The doctor recommended cutting the tie when he was 1.5 years old, but I was afraid of anesthesia. Is it still necessary to do the procedure now, or are there other ways to improve his speech?
Um, Improving his speech. See, speech issue means mostly children tongue tie. What we notice is the child has a lot of clarity issues. Clarity issues, we need all our articulators, that is our tongue, our mouth, all these things to move in a proper way in order to correctly produce or pronounce the words. Now, if your child has a tongue tie, I'm sure that his tongue movements would be affected, because of which he might not be able to clearly produce many sounds. So, in future, what will happen is, even when he develops a very good language, we will have this issue of unclear speech. So, it is always important that if the child has a tongue tie which is affecting his speech clarity, I think after consulting, it's better to get it removed.
Yes, correct. Yes, okay. Thank you, Navya ma'am. And I hope that is answered. Okay, so Sajna ma'am has another doubt. She says, should I wait for more? What is the normal age for preterm for their clear vocabulary? So that is a next part of the question that she has already asked. So she has also said, is it necessary to start speech therapy now itself for her speech delay? Okay. So the
So
I
even for,
yes, yes, Miss Navya.
yes, so for term babies, we always say that you do not calculate their age based on the day they were born, calculated on the basis of the day that they were supposed to be born. Okay. I hope you got my point. It delivered 7 months. Okay. You shouldn't be considering that as your proper, I mean, though the chronological is that, we will always consider, and the doctors always say that, consider the due date of the child while coming to mental things. So, if in that case it is fine, but more than that, if you feel a delay, I think definitely then wait more than that.
Yes. Okay,
I
yes.
hope that's clear. It was a bit confusing. I mean, the way
Sa
I
Sajna ma'am,
told you.
is that clear, Sajna ma'am? Yes, I am assuming it's cleared. Thank you, Navya ma'am. Moving on to another question. Okay, Kamal ma'am is saying thank you. Thank you so much. Okay, another one is by Fatima Meher, Miss Fatima Meher. She says, "Hi, ma'am. Firstly, I want to thank you for the wonderful session. My daughter is 7 years old. She's facing hearing problem and she's using hearing aid. So she has speech difficulties and language problems. She struggles to communicate. She's using word by word. Sometimes she expresses her thoughts through drawing. I would like to understand how to support her better. Please guide me."
I think your child is 7 years old and she has a hearing problem. So definitely your child should be receiving auditory verbal therapy, that is AVT. It is a specific therapy designed for hearing impaired kids. And since you're saying that she expresses her thoughts through drawing, means she is a very good artist. And also, I think her thought processes, her way of thinking is all very intact, and she wants to express her. And so that could be the reason that she is drawing, which is actually very sweet. But yes, coming to her language part, address this issue, you will have to take your child for a detailed evaluation, and we will have to language development.
Okay. Yes, Navya ma'am, thank you so much. Uh, Moving on to another question. This is by Preeti H. Preeti ma'am. She says, "Thank you for this informative session, ma'am. Can you suggest any online therapy material for social communication disorder?"
Okay, so primarily for social, just like that, even in Google or wherever, if you just type this or something, I do not think any materials will be readily available. And also, it mostly it does not depend on the material that we use. It mostly depends on the way we frame questions and the way we are trying to train the child. So even though we may be using a very simple picture, but the questions that we frame for the kid would be very different, and that is how we improve the child.
Yes.
So, yes, so it is
Yes.
basically picture stimulus if you want to know, mostly any videos, any picture stimulus, but it all depends on the way we are framing the questions for them to answer and understand the concept and the context better so that they can communicate according to the context they are in. I hope that's clear for you.
Okay, I hope that's cleared, Preeti ma'am, and thank you, Navya ma'am. And so next one is, okay, thank you, ma'am, is what Fatima Ruxana ma'am is telling. Next one is Bimla ma'am is telling, "Hi dear, what is the language daily? What are the symptoms? Please, can you explain? Thank you." I mean, Bimla ma'am, we are not really able to comprehend the question. Could you specify in detail as to what you're trying to say, Bimla ma'am? Also, Sajna ma'am has said, "Yes, got it. Thank you. Thank you, Sajna ma'am." And Fatima Meher ma'am says, "Thank you, ma'am." So she's thanking Miss Navya. And then we have Izin Zad sir, I suppose. Yes. He's saying, "Thank you, Navya ma'am. I am Izin ma'am. You are our therapist." Okay, okay. Thank you, Izin. Thank you so much.
Yes, kids.
We have Bima ma'am, I suppose. She's saying, "I couldn't join the webinar on time, so I missed the session. My child is 1 year and 9 months old. He only says 1 to 2 words, and that too rarely. So is there a need for speech therapy?"
Yes, that's 9 years, and the child is not to, definitely you will have to take your child for a detailed evaluation and consult a qualified professional.
Yes, correct. Okay, so that is all the questions that we had. And so thank you so much, Navya ma'am. Thank you for this wonderful, wonderful session. And also to all our
Thank
participants,
you.
thank you so much for attending our session today. We really appreciate your time and participation. And we are very sure that all of us had an amazing learning session today. And it was something very new, very different from the very traditional speech delay, speech related disorders that we have all heard of. So thank you so much, Navya ma'am, for that. It was a very fruitful session and a very empowering session, very empowering for all of us. And thank you so much for sharing your knowledge and expertise with all of us. Thank you so much for your time and effort, Navya ma'am. Thank you so much.
It's my pleasure. And thank you to all of you, each and every one, for joining. Thank you so much.
Thank you. Yes, is there any question? Anybody? I mean, I'm assuming because the mic was turned on.
Can you answer my question? I just typed it here.
Yes,
My name is
yes,
Nina.
Okay, we didn't see it, ma'am. We didn't see it.
yes.
I'm sorry. Did we miss that? I'm sorry.
I think it's the last one.
N-
Yes, it's the last one.
Is it? Is there? Okay, okay, okay. Sorry, we missed that.
Yeah.
Okay, thank you for the session. My 3-year-old son started taking parental guidance from Sphecho. I don't get to spend much time with him, hardly 6 to 8 p.m. He's attending play school from 8 to 12 p.m. I feel guilty for his autism spectrum disorder and speech delay. How can I improve his speech delay? Okay, yes, Navya ma'am.
So I am happy that 3 years is actually occupied. I mean, a day might be fruitful because morning he attends school and he is also in program at Specco. I'm really happy for that. But again, I'm telling you, any therapy you attend, any parental guidance you sitting with him will be hardly spending 40 to 45 minutes with your child. Even in school, it's the same. It should always be, or it is parents most of the time with the kids. So even if the therapist tells you 10 things to do, it you should always make sure that you are, because if that is not the case, how much ever input we give you, your child will not get it the same way, the right way, the way we are expecting, because there is something happening in between. There is some delay, what to say, some communication error, some disruptions. I understand your point. I understand that you're guilty and you also know that your child needs to be improved, but as a professional, understanding your point as well, I can only say that you have to spend more time with your kid. And if you are not able to spend, anybody who is looking after your kid or anybody who is with your kid for more duration should be able to practice these things at home. That is whatever insights you get from the parental guidance program or the therapy sessions. The person who is spending time with your kid should be able to incorporate this in his daily day activities. In that case, definitely you will see an improvement. I hope that's clear.
Yes. Yes, ma'am. We hope that Navya ma'am has answered your question. So it's time to wrap up the session. I mean, from on behalf of Lopo community, on behalf of Specco, we would like to thank all our participants, and we would like to thank Miss Navya for all the efforts that she took to deliver such a strong message and deliver all the information that she's delivered today. Thank you so much, Miss Navya. So we'll be wrapping up the
Yes.
session today, and we'll be back another time next month, inshallah, with another session with which will be again very informative session. So for today, it's a wrap, and we'll see you soon. We'll see all of you soon, inshallah. All right. Thank you, Navya ma'am. Thank you so much. So we'll end the session now.
And
Thank
thank you,
you.
Sarah.
Thank you.
Sure.
All right. Have a good day, everyone. Goodbye.